My name's Adam Lewis. I'm the Global CTO for Healthcare and Life Sciences at Atos. Today I'm going to talk about key challenges in global healthcare and how they can be helped with innovation. Firstly, the global population is estimated to reach 8 billion before 2025. The ageing population in particular, the number of people over the age of 80, is set to triple in the next 30 years. The rising cost of healthcare is also significant. For example, it's estimated that the average American household cost of healthcare has doubled since the 1980s. Add to this that many healthcare providers have burning platforms. It's clear that it's not only a necessity but a priority to modernise the way healthcare is being delivered and also consumed. The second point is around understanding that changing population dynamics also shift the focus of healthcare away from treatment to prevention. Focusing on wellness and using that data to predict and to prevent illness, and also to proactively deliver connected, personalised or precision care. This in turn will reduce the financial burden and reduce that burden on healthcare payers, insurance companies and individuals alike. 1, I would say burning platforms and ageing systems. 2, the lack of investment over many years. And 3, the availability of skills on the market. One recent report, in fact, from McKinsey highlighted that for each $1 spent and invested in health, there could be an estimated economic return of $2 to $4. Add to this is estimated over 70% of health improvement comes from environmental, social or behavioural interventions and the preventative measures that healthcare can provide. Unexpectedly, the pace of innovation since the start of 2020 has driven a tectonic shift in investment across all areas of health and life sciences. Working in conjunction with a world-renowned cancer clinic, it became apparent that their digital strategy required implementation of an agile, secure and scalable cloud platform, supporting the advancement of diagnosis, the treatment of disease, and achieving this would significantly transform patient care through the collection, management and the analysis of genomic data. Atos established a Google Cloud environment that included network, security, billing, monitoring and alerting, together with identity and access management, all to securely set up cloud-based projects for the organisation while securing their important patient data. 1. Focus on patient and redefine their experience. Focus on the technologies and solutions that enable the highest quality of care to be attained. 2. Look beyond traditional care settings. Use the wealth of data unearthed that is now available to drive insights, encourage wellness and proactively assist in managing the resources you have which are available. 3. Understand the value and technologies such as high performance compute, artificial intelligence and machine learning and what they can bring. Then make sure you choose your platforms wisely. Working together with Google Cloud and Atos, many of our customers across healthcare and life sciences industry are already realising this is the start of the most important and valuable journey, transforming and improving countless lives all over the world.